So we'll move now to the next slide. We're going to talk a little bit more about that first stage of labor, and this is the stage that is going to last the longest. The most interesting things will be happening, and you'll get to make several choices about your labor and birth during this first stage. And I like to bring that forward because it's good for you now to be educating yourself and recognizing what's going to be happening in labor and what kind of decisions and choices can you make along with your healthcare provider and your support person. So if you can see from the slide, we're talking about the first stage of labor. And again, we call that, it's divided into 3 phases. And the first phase is the early or initial phase of labor. So in early labor, we're going to have more effacement and the cervix will start to dilate. So we typically consider the early phase of labor to be dilating to about approximately 3 centimeters, so 0 to 3 centimeters. And we won't notice a lot of descent from the baby, but this is where your cervix is really getting effaced or softened and just starting to open up a little bit. Some women will go through this early or initial phase at home. They're fairly comfortable, and other women will come directly into the hospital and feel some pretty intense contractions during this early labor phase. So again, remember, every woman is different and every pregnancy is different. But this early or initial phase of labor tends to be the longest in duration, and it can be upwards, 6 or 8 hours in that early labor phase. So if you're at home, you're comfortable, your contractions are regular, your bag of waters has not broken, we do suggest you stay at home in the comfort of your own surroundings. But ensure that when you start getting more uncomfortable and the contractions are getting closer together and more intense, then you want to head into the birthing center. And again, think about traffic, how far your drive is, and don't time anything too late. But I like women to understand that early labor can be a long process and they may be more comfortable in their own home. So if we then move from early labor into the active labor phase, we typically would characterize this as the cervix dilating somewhere between 4 to 7 centimeters. And this phase is usually shorter than the early labor phase, but it's much more intense. And having seen over 1,000 births, I can tell you that it's pretty obvious when a woman moves from early labor into active labor. It's a different feeling. The contractions are stronger. If the bag of waters is broken, then the baby's head is even down farther onto that cervix, and you may feel some more intense discomfort with those contractions. So this would be the phase in labor where if you're fine up walking around in your room, that's what we would prefer. Anytime you can be mobile or sitting up or walking, it's much better for the baby to be able to move down through that vaginal canal and to get settled into a good position, and your labor is usually quicker if you're more mobile. However, if you've determined that an epidural is important to you, then this would be the perfect time for us to place that epidural during that active labor phase. And the only reason for not placing it too early is that may slow down your labor a bit, and then it puts you in bed, unable to walk around, and it's just not as conducive to a healthy, more efficient laboring phase. So we've gone through early phase, active phase, and now the transition phase. Transition is typically characterized as the cervix dilating somewhere between 8 to 10 or all the way or fully dilated. This phase can be quite intense, but again, it's usually quicker. It can last an hour. I've seen actually women with 4th and 5th babies that go through the transition phase in about 10 minutes. So this is quick, it's intense. This is a much more difficult time for us to put in an epidural if that was an interest to you. Because the contractions are much closer together, about every 2 to 3 minutes, they're very intense, and it's more difficult for the woman to lay still in a position to have an epidural placed. However, if you're up, walking, mobile in the room, that will help the transition phase to go even more quickly. Or even if you're just sitting up in bed. Again, think of gravity. We want the woman sitting up as much as she can for labor. So we will now move to the following slide, and that is the second stage of labor. So the second stage begins with the fully dilated cervix to the delivery or birth of the baby. So we call it the pushing stage. And you can see from these pictures on the slide that the best position for your baby to deliver, of course, head down is important. If it's not head down, you've probably been talking to your healthcare provider about a cesarean section. But we need the baby head down to deliver vaginally. And you'll see from the picture that the baby's face is facing the mother's back. This is called the anterior position for birth, and this is just the easiest way for the baby's head to be born. And the head will be the largest diameter that needs to fit out through that pelvic outlet or vaginal opening. So once we can push and get the baby through and the baby's crowning, that means that we can actually see a portion of the baby's head at the pelvic outlet when the mother's pushing. This stage for first-time moms is longer. Not uncommon for it to be 2 hours. Second, third, fourth time deliveries, women can push sometimes 10 minutes and the baby's ready or crowning for birth. So again, you're going to be using your muscular contractions along with the uterine muscle contracting. We're going to use those two together to push the baby through the vaginal opening and to birth the baby. So if we look at the following slide, the third stage of labor, this extends from the birth of the baby until the placenta detaches. You can see here there is a picture of a placenta. You can see the cord attached to that placenta. This stage of labor takes anywhere from 5 minutes to 20 minutes. Usually it's 5 to 10 minutes for that placenta to detach. And we will actually cover this a little more in depth during week 4 when we talk about the actual birth of the baby. And we'll talk a lot more about pushing and how we want to breathe and the most effective way to birth your baby. And that will be coming up in the following week 4. So let's briefly talk here about that fourth stage of labor or postpartum. This, again, is from the birth of that placenta or delivery of the placenta through those first 4 hours is very critical for both mom and baby, and then up to 6 weeks after the birth. And our next slide is going to talk a little bit about medications that we use early in labor. So when I talk about early, I'm really talking about that, not only just the first stage, I'm talking about that early or initial phase of labor. And some of the medications we use are opioid, which are narcotics. These will help the mother relax. However, they will stay in the mother's system about 4 hours. So we wouldn't want to give anything to you in labor if we thought you were going to deliver your baby within 4 hours after we gave that medication. The narcotics tend to decrease the respiratory system, and if a baby's born with narcotics in their system, they don't tend to cry and breathe well, and sometimes we have to give them other medications to offset that narcotic. So if we're going to use any of these medications in early labor, know that we will really recommend them for that early or initial labor and not usually that active or transition phase. So let's talk a little bit about pain thresholds. The pain threshold is remarkably similar in everyone. However, there are some cultural differences that play a definite role in a person's perception of and their behavioral response to pain. So the meaning of pain and the verbal and nonverbal expressions of pain are learned from interactions, usually from your primary social group, which for most of us would be our family. So pain tolerance then refers to the level of pain that a laboring woman is willing to endure. Once this level is exceeded, most women will seek some kind of measures to relieve that pain. So some comfort measures can be used to relieve the discomfort of labor. Typically, if we relieve anxiety, this can help a woman experience the birth process and transcend that discomfort of labor. So a lot of what we would call discomfort is anxiety, and women tense up. And much of that anxiety can occur because they don't know what's happening in labor. So I would tell you and congratulate you today, because the single most important way to reduce the anxiety of childbirth is for you to learn more about the birth process and to be actively engaged in your own childbirth and childbirth preparation. Some of the common comfort measures that we can use in labor are relaxation and breathing techniques, music, guided imagery. We can use light massage, water therapy, sometimes we call that hydrotherapy. I've seen acupressure and acupuncture used. We can use heat and cold. There can be biofeedback mechanisms that we can use, aromatherapy, and even down to what we call hypnosis, or hypnobirthing is a common term. Recognize that all of these comfort measures can work, but these are things that need to be researched and practiced long before you come to the hospital. So we will discuss some of these later in the classes and go into a little bit more depth. But if one of these already kind of sticks out to you as something interesting, I would suggest that you now research that topic and practice that at home and see if that's something that you think you might want to use during childbirth. And the good news about that is you're using or learning a stress reduction technique that will help you for the rest of your life and not just in childbirth. So again, if something's of interest to you, you can even find classes, usually at your local hospital or birthing center. You'll see that there are some classes offered to learn some of these different techniques to help provide more comfort. Sedatives can be given in early labor. Again, a sedative will help you relax and actually sleep. They do not relieve pain, but sometimes we'll give a sedative with an opioid analgesic, and that sedative can also help reduce the nausea that may accompany the opioid. So opioids are narcotics, and they do relieve pain. They block some of those pain sensors, and the most common ones that we use in childbirth, we use for sedatives, we'll use something called Seconal, Phenergan, Visceral. These might be common things that you'll find in your birthing centers. Analgesia, again, alleviates the sensation of pain. So for an actual analgesic, we typically give opioids, and these will blunt the perception of pain, though they will not eliminate it completely. The one thing that would eliminate it would be having a total block with an epidural. So opioids do cross the placenta. They will affect the baby. So we're very careful and cautious when we give opioids. And the other thing is they can also inhibit or slow down uterine contractions. Now, this might actually be helpful for the laboring woman who continues to be in false labor or she has a really prolonged early labor phase. And sometimes first-time moms will have false labor or an early labor phase that lasts up to 24 hours, and they're just miserable. So we can give them an opioid, help them sleep. The contractions will slow a bit. And then hopefully once they get some rest, then when true labor begins, they'll be in a better position, have the rest that they need to be able to get through labor. So the common opioids that we give are Demerol, we give morphine, fentanyl, and another drug called Sufenta. So on the final slide for week 2, we're now going to go a little bit more in depth into some of these relaxation and breathing techniques. Recognize that we can divide them really into 2 categories. We call them attention focusing techniques. The main one there is imagery or guided imagery. And the second characterization is they're called distraction techniques, where we're really using different things to distract you from the discomfort of labor. So these techniques can reduce tension and stress, which can allow you to rest and conserve your energy for the task of giving birth. When you're in that second stage and you're pushing, that requires a lot of energy. So if we can conserve energy throughout the first stage of labor, we'll use these relaxation and breathing techniques to help conserve energy. So we have actual research that has shown that attention focusing and distraction techniques are effective to some degree in relieving labor pain. Some women like to bring a favorite object or a photograph to the birthing room, and they will focus their attention on this object during contractions. So as the contraction begins, you can focus on that chosen object and perform a slow, deep breathing technique to reduce that perception of pain. Again, you're taking your attention to something else, whether, a stuffed animal, a picture, maybe you just find an object in the room, and you're going to focus your attention on that during the contraction, and you're going to use a slow, deep breath in and the same breath out. So if you were breathing in 2, 3, 4, you'll breathe out 2, 3, 4. With imagery, the focus is on a pleasant scene or a place where you may feel the most relaxed. And I find this is different for all women. For example, you could imagine walking through a beautiful garden while breathing in light and energy and healing colors. You might be on a beach somewhere where you can hear the ocean waves. But what you're doing is you're taking your mind to this other place during that contraction, and you're using that same nice slow breathing. And while you breathe out, recognize that you are breathing out tension and anxiety. So you're breathing in healing light and energy and colors and ocean waves, and then you're breathing out tension and anxiety. So the distraction techniques, typically we would consider them touch or massage is a distraction technique, and it's a common technique that has long been an integral part of the traditional laboring process. So touch can be as simple as holding the woman's hand or stroking her body, her legs. It can be embracing or holding her. Let your support person know what kind of touch is helpful, and recognize that what you think you may prefer now may change as labor progresses. So some women enjoy the light stroking of the abdomen, that we call that effleurage. It's a very light stroke on the abdomen. It's soothing for some women, but it might be annoying to others. And it may be something you enjoy now, but when you get into active labor, it may not feel the same. So be very verbal and communicative with your support person about what's helping and what isn't. Also, the use of counter pressure on the lower back. This can be particularly helpful as labor progresses, especially for women who have a baby that is in what we call the posterior position or face up. That tends to put a lot of pressure on that lower back, that sacral region. And so counter pressure by pushing with your hand during a contraction on that lower part of the back might be really helpful to alleviate some of that discomfort. Always, again, let your support person know what's working and what's not as you both kind of progress through the different stages of labor. So music can provide a distraction. It can enhance relaxation. It can even improve your mood during labor, which then reduces stress and anxiety and the perception of pain. So music can be used in early labor to promote relaxation. It can be used through the active and transition phase to stimulate movement. That helps, again, when you're moving to help the baby descend. You should really create your own playlist. I will tell you that I've been in labor and delivery rooms with anything from Enya all the way to Van Halen. And so it's whatever you enjoy. You might consider bringing headphones or something if you want to play it loudly so that, it's for you and it wouldn't be disturbing to other people. But recognize most birthing centers have some way to play music, but I would, again, check with where you're planning to deliver and see what kind of equipment they have. So with breathing techniques, we teach you these because they do provide some distraction during labor, which, again, when we distract you, that can reduce the perception of pain and help you maintain control during those contractions. So breathing techniques used during that first stage of labor can promote relaxation of the abdominal muscles. Can you imagine if we can relax the abdominal muscles, this will lessen that friction between the uterus and the abdominal wall during the contractions. So in second stage labor or pushing, we will then focus your breathing to increase that abdominal pressure to assist in delivering your baby. So understanding the different ways that you need to breathe to help relax the abdomen and also help increase that pressure during the pushing stage will help you during your complete labor and delivery. During the actual delivery, you might be asked by your healthcare provider to stop pushing for a moment. And that can be somewhat difficult. So we'll help you take short panting type breaths so you can pant and relax those perineal muscles. And sometimes this will help slow the birth of the baby's head, which could decrease any tearing or the need for an episiotomy. So a variety of breathing techniques are discussed in week 3. I just would suggest that you practice these various breathing techniques prior to labor. It's imperative if you want to be able to use these during labor that you practice them, and I've seen them over and over help facilitate a more comfortable, controlled, and efficient labor and birth. So with that, that's the end of our week 2 information, and on to week 3.